So, Rebecca, you have a email or a question or something for me. Give me this question.
So the question is, are there some people that aren't appropriate for individual talk therapy?
Interesting. Are some people not appropriate, meaning it's not going to be helpful, or is that what you're saying?
Yeah.
It's not indicated, as they say.
Yeah.
Okay. Yeah. Okay. Well, let's talk about it. I'm curious as to what generated this question from you. Let's introduce the podcast. This is the Psychology in Seattle podcast. I'm your host, Dr. Kirk Honda. I'm a therapist and a professor. Who are you, Rebecca?
I'm Rebecca Bloom. I'm a licensed mental health counselor and a board-certified art therapist in Seattle.
So what precipitated this question?
Well, it's happened a couple times recently, and I got an email just this week of a mom looking for therapy for their adult kid. And it's one of those things, like, a lot of things haven't worked, and we've heard art therapy is helpful to people. My adult daughter has no insight and denies the diagnosis that she's been given. I'd like to make an appointment with you.
Oh, God. Yeah, I used to take these cases because I just generally had a optimistic outlook. But with personal experience, I have learned that those cases always go south quickly and require a lot of headaches and emails and phone calls and annoyances that I just don't want to deal with in my life. Because essentially the thing I'm detecting is, and you tell me if this is what you're detecting, is you have someone, you basically have a family that's in conflict, right? You have a parent or some other family member who is in conflict with another family member. And so you have two people that are fighting for many, many years, probably. And then at a certain point, one of them says, this other person that I'm in a fight with, they need to go to therapy because there's something wrong with them. And then the other person's like, F you, I'm not going to therapy. and then, but then the person who's like hell bent on pushing the other person into therapy ends up calling us in maybe, kind of out of desperation, or they just had a big fight with that person or something. And then in the beginning, what I would hear would be like, oh, well, someone else is just being nice and they're calling around to get a therapist for their loved one. And yeah, go ahead, bring him in. But what ends up happening is this other person who has a long track record of not wanting to go to therapy is probably still beholden financially to this other person, because they're a kid or whatever. And so they might be in a position where they have to be forced to go to therapy. And so so this is what would happen is, I get this call and I'm like, okay, yeah, sure. Okay, so, what times work for you? And I'll be like, oh, well, now normally in a situation like this, we would just make an appointment. But I'm actually dealing with a broker at this point. I'm dealing with like an in-between man at this point. And I'm like, oh, okay, well, I have, these times. And then the person's like, oh, okay, and they're like, what's your approach to stuff like this? I'm like, oh, well, okay, and I give him my approach. Okay. And then you get off the phone or whatever, and then they go to this person presumably and have some other series of conflicts with this person. And then the person, calls me back and says like, well, so none of those times are going to work, and so how about, this other, actually, Kirk, could you actually call my daughter? Maybe if you reached out to her. Now, in the beginning, again, when I was desperate, I'd be like, okay, and then I'd, get the phone number, call the daughter doesn't answer, I leave a voicemail. Mom calls me back. Did you call? Yeah, I called. Then if daughter actually does arrive, which wasn't always the case, daughter plops down on my couch and says like, so what? What are you gonna do, to help me? And then and I quickly realized, oh, this person doesn't want to be in therapy, and now I'm in a position where I have to somehow cajole. And again, at the beginning of my career, because I was desperate, I would I would try. Either I needed hours or the money or the private practice time or something, so I'd proceed to spend, as much effort as I could and, annoyance and sort of blood, sweat, and tears trying to convince this person that I'm a good therapist and that therapy isn't painful and that, at the very least we could just hang out and talk and da 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 da. But at my old age, at 46, as they said in the 90s, homie, don't play that. So that was the 90s, right?
we can only hope. And I can't remember what decade that was the catchphrase.
Or as they said in 2010, ain't got time for that shit.
Right.
Or what was that? What was that? Is this your experience?
Yeah, so I think what's interesting, and this was actually said best at this suicidality training that I went to, where the very esteemed MD, Mr. Suicidality from Harborview, which for those of you who aren't in Seattle is like the premier crisis hospital for like many states, said not everyone is appropriate for individual therapy for a variety of reasons. And as a therapist, you're allowed to say to somebody, you're not ready to be here.
Yeah.
Here's a series of other places that you can go. But I think it's really hard for people to understand that like therapy takes motivation. It's not like some kind of passive treatment.
Right.
Like an ointment or something.
Yeah, exactly. Again, in my early career, and I talk with a lot of supervisees about this, because supervisees will take these cases, because they're so desperate in early career, they'll just take anything, And what I'm always telling you, supervisees is, whatever it feels like this is worth it to you, it's not. Because not only will a case like this require like 20 hours of annoyance, but you only get paid for maybe one of them, maybe two. If that, because these are the sort of clients that don't pay too, by the way. These are the sort of clients that you send the bill to and they're like, well, he didn't really help my daughter, so I'm not going to pay for that. Or, well, the daughter's supposed to pay because she's 25 and she needs to pay for that, and daughter, of course, doesn't pay. So this is also one of those cases where you might not ever even receive any payment from anybody, So not only will it sort of drain all this time and for not getting money, but it ruins your life. The average, most clients, they call and they're like, I finally found a therapist that has room in their schedule. Oh my God. Can I come? And you're like, well, the next available time is in 3 weeks. They're like, oh, I'll take it, and they're there with bells on, and they're like, okay, I've been waiting to talk to you for 5 months. I have so much to tell you. Let me tell you. And then and you provide empathy and therapy and all the things that you got, and they go, that was so good, thank you. And they walk. That's normal, okay? To have a situation where someone is basically being coerced.
Well, for some people, the interrelational process of sitting across the room from somebody is hard. And either they don't have the ego strength or they're just not ready or it's too triggering. Like I'm thinking of a client who recently just kind of no-showed and disappeared on me. And they would sit across the couch from me and I could tell they weren't breathing. They were often glaring at me. And it was like there was no positive experience happening here.
Why do you think they didn't want to be there? Or why do you think they were presenting that way?
I think they were flooded by the relationship. I kind of asked, like, you have to look at yourself. And then there can be this dynamic in therapy where everything the therapist suggests, the client says, no, that doesn't work for me. I've already tried that. That doesn't work.
Yeah.
And we know that resistance is important.
Yeah.
And it's there for a reason. But, at some point I have clients that I regularly confront and say, why do you come if you don't want to do any of this? And they say, oh, you're right. All right. Okay. What of the list of 20 things that you mentioned am I willing to do? And we figure something out. But if somebody consistently, week after week, isn't ready to do any of the things that you recommend, it's possible that people just aren't ready. For some people, groups are more appropriate. They can, like with teens, it's common that they do groups, or with DBT, This idea that they can hear it from their peers better than they can hear it from somebody in authority. So, unfortunately, we live in a world where groups don't exist anymore. So that's what I wrote back to this mom was, I'm a solo practitioner. Like, your relative would be better served doing a DBT skills group until they're ready to admit what their diagnosis is, or going to some kind of intensive outpatient.
But they're not going to do that because if they're not going to go to all the other services, they're definitely not going to want to go to a DBT group, right?
I guess some of it was psychoeducational for me, for the mom, because sometimes, and I feel this when I present too, people want art therapy to be the answer.
Right. Art therapy isn't any easier for someone than anything else. It's not like all people do is come and draw pictures. It's therapy in the context of art. Right?
Right. This idea that like it'll be fun and non-threatening, and they'll be this person's buddy all of a sudden, and it's like really people get pretty freaked out with what happens, and can get pretty overwhelmed. And if that's been their experience with everything else,
right. Right, and it's sort of insulting, isn't it? Kind of.
I think there's this idea that it'll be nice and fun, and I'll build a rapport with someone who's never been able to build a rapport with anyone else, and then once that rapport is built,
then you'll stick it to them.
Right, we'll hit the heavy stuff, and it's like,
Well, here's what I say to people, and I try to use it as a psychoed moment myself. Is I tell people, so in order for therapy to work, in general, it has to be voluntary. People have to want to be in therapy. They have to ask their therapist for something. They have to want to go. And when they're there, they have to say, okay, my therapist, please help me with X, Y, or Z. Now, X, Y, or Z could be as concrete as something like, quitting smoking, or as amorphous as I want to explore myself or something. So, but there has to be something they're going there for that they want inside of them. When you impose something on somebody, then it doesn't work. It's akin to sending someone to get a vaccine who doesn't want the vaccine. The person, if they're an adult, they're going to walk in there and go, why are you here, sir? And they're going to be like, I don't know. My mom dropped me off and made me show up. And they're like, and the doctor isn't going to just stick the person with the vaccine unless they ask for it. They have to consent. And so maybe that's a bad analogy because therapy isn't, like a needle, but the point is that it's voluntary. And so that's what I say. I don't refer them somewhere else because I would assume that any other service would be just as unlikely to work. And what I'm trying to tell this person is stop bothering professionals, like figure out another solution, like I don't know what your situation is, but maybe you need, so that's another thing is I throw out to people, like I say,
I'd be happy to see you.
Yeah, I'd be happy to. I've talked with plenty of people in your position, and you seem motivated, and there are strategies about how to alter someone else's behavior that's in your system. It's not obviously guaranteed to work, but there are approaches that are better than others, and as a family therapist, I help people out with that. 99% of the time, that person's like, I don't need therapy, it's my son, and I'm like, okay, great, see you later.
How's that working?
Yeah. So that's sort of my approach.
If you have a suicidal client who is obstinate, you are allowed to say to them, I can see you're not ready for individual therapy. Whereas what many therapists feel like is they have to continue to see this suicidal client when really the client can't tolerate the therapeutic process, and it's okay to say to them, here are XYZ resources. If you're ready for treatment, come back, but you can't kind of abuse the process in this way.
Yeah, absolutely. Yeah, I completely agree with that. Yeah, there's this notion that they're suffering, and so it's my responsibility since they came to me, and that's just not the case. There's a contract. It's a two-way street. The client has to bring certain things to the table, like a willingness to work and a willingness to, some willingness to have a conversation about this sort of stuff. And if they're not, then people, I think, are completely free to essentially terminate and say, and to provide a recommendation, right?
Yeah. So if you're sitting on the other side of on the couch, just glaring at your therapist the entire time, waiting for them to prove that they're trustworthy,
go to our therapist because they'll be able to save that situation.
Therapy is not happening. If you are shopping for a therapist, you got to find someone that you feel like you could trust.
Yeah.
And that's on you.
Yeah.
Not on the therapist.
Yeah. Well, good, interesting. That does it for that episode of Psychology in Seattle. Thanks for joining us out there. Please take care of yourself, because why, Rebecca?
Well, someone's got it. I don't know. I hope it's you.